Well, good afternoon and welcome back to our media conference and live stream for the City of Hamilton update on the COVID-19 crisis we're dealing with. Thank you all for the good work that you're doing out in the broader community. My sense is that the majority of our population is doing what their public health leaders are asking them to do, and that's very, very important. As I've said before, and I'll say again, all the work that we're doing here to close things down and manage the day-to-day affairs of the city and make sure you get the proper guidance means nothing unless you're contributing and doing your part. So continue to do your part. It is critically important. Today, we're actually asking the community at large, any businesses or anyone out there that has personal protected equipment, gloves, masks, and sanitizers, if they could get a hold of the city at ppe@hamilton.ca. or call the city at 905-546-2424, extension 2257. We would love to have your available equipment to get to the frontline workers here in the community. So there's a need. If you can help us address that need, please provide what you're not using now and bring it to us so we can get it to people that desperately need it, that are helping those that are ill. Thank you for that. And again, I stress that this is a very serious, important issue. Our crisis continues, and it's not going to end anytime soon. At the same time, we also know that it's causing stress in the community, and potentially folks that are already stressed are feeling even more stressed. So if you have that issue going on, please reach out. You can call COAST at 905-972-8338, and there will be people there to help you. Again, the Premier yesterday announced that all gatherings of 5 people or more are to be prohibited. That does not mean 5 people in a household, but anyone else beyond that should not be coming together. It also exempts child care centers supporting frontline healthcare workers and first responders. We certainly know that kids in our community are challenged right now as well. I know the Prime Minister put a significant amount of money into Kids Help Phone to ensure that any kids out there that are stressed or in a domestic challenge or are needing counseling at all can get help and assistance. And those kids could call anytime. Text, actually. Kids probably more interested in text. 686868 is the text number. And you could call 1-800-668-6868 as well and get help. Please do reach out if you're having some of those challenges. Very, very important that you get the assistance that you need at this point. Seniors are asked to stay home as much as possible, especially seniors over the age of 70, and especially seniors that already have compromised immune systems or medical conditions. Please stay home as much as possible, if not all the time. If you can get help and assistance from your family to help you do that, that would be a very, very wise choice indeed. And I know that the government may be making more stringent announcements on that in the days to come. The Ontario government also has put $10 million towards subsidizing delivery of meals, medicines, and other necessities to seniors. Very helpful initiative that will help you stay at home, but have others provide the supplies that you need on an ongoing basis. And I know the grocery stores are starting to have identified and continue to identify hours for seniors only, both at pharmacies and grocery stores. So watch out for that and take advantage of that, seniors, because then you can be isolated from others that might be carriers as well. Everyone else, stay in contact with your seniors. Make sure you look out for your parents, your grandparents. They're particularly prone at this point in time, and they need your help and assistance probably more than anyone else. Council will be organizing a virtual council meeting for Monday, April the 8th, to deal with some of the significant issues that we're going to need to deal with. We'll have a condensed agenda, I'm sure, some of the more critical issues that we need to decide on going forward, so that will happen on April the 8th. And Wednesday night, 7 p.m., our virtual town hall is on again, in collaboration with Cable 14 and live streamed as well through the City of Hamilton's website. So you're requested to submit your questions by tagging @City of Hamilton on Twitter or submitting a web form at www.hamilton.ca, Ask COVID Questions, A great way to get your information to us or your question to us that we can have then our panel provide some answers for. And before we even get finished here, I'm going to thank our American Sign Language interpreters, Rosalie Vizers and Georgia Whalen, who are again doing their 30-minute workout here. So thank you so very, very much for the work you're doing. And I'm going to now turn it over to Paul Johnson, who's heading up our Emergency Operations Center. Paul?
Thanks, Mr. Mayor. Obviously, we were interested in the announcements today from the Chief Medical Officer of Health for the Province of Ontario, and I know that Elizabeth will have some more to say about new guidelines. This will also affect, how we're enforcing out in our community. So now gatherings in group, as the mayor said, larger than 5, now fall under the provincial order. And if folks feel that there are businesses or gatherings that are happening with more than 5 people that are outside of what should be happening in the province, they're encouraged to call 905-546-CITY. And we are working, our licensing and, our bylaw officers are working alongside the police to enforce that. And today, we also, or in the last day or so, have received some support from the province for our bylaw officers to take more of that role and take on the ability to find and take care of some of this business. On our website, there's also numbers that you can call for other initiatives. If you think that a business is not essential and is still operating, there's numbers for that. There's now price gouging numbers that you can call and report in. But I think what's really important from our perspective as a city operational team is ensuring that we are doing as little as possible to encourage people to take trips to do things in the community. Basically now we're all being asked to have a very limited amount of movement in the community, and we will do everything as a city of Hamilton to reinforce that. Even if we can't fine and even if we can't take some of these other actions, we'll be encouraging that. We'll be closing access to parking in certain areas that encourages people to travel to go for a walk. Chief Medical Officer of Health was clear, walking the dog, fine, but you don't need to travel long distances and park somewhere and go into an area to do that. So limit your activity and limit your movement, and the city will be working hard to encourage compliance with that. It is really important. I do want to thank some of our city staff who are finding creative ways to do our business and to help protect Hamiltonians. In particular, I'm told that by the weekend we had over 200 inquiries by healthcare and essential workers in terms of the child care that's available to them in the community. I want to remind folks that in Hamilton, we decided to take the approach that rather than open a few centers, we've done it through licensed home child care. That means that licensed home child care spaces are available in just about every corner of this community. And so it's not about 1 or 2 or 3 centers that may be located in geographical areas that are tougher to get to. Families, I think, will be able to find and certainly reach out and look at options that are closest to where they need them to be. And so I thank our child care folks for the work they've done in getting that up and going so quickly. I also do want to mention, and Elizabeth would have more information from the case perspective, but I do want to mention that as reported today, we do have an individual that is now in the isolation shelter that we set up as part of our approach to dealing with COVID-19 within our homeless population and our shelter system. The bottom line is the system that we set up works. And so I want to thank the people that worked hard in the weeks leading up to where we are today to ensure that we weren't reacting to situations, but we're proactive and able to handle situations as they arise. So again, through today and into tomorrow, I think a big decision that's coming this week is, of course, the closure of city facilities, and we are coming up to April 6th. And I can say that our hope is to get an announcement out tomorrow regarding the extension of that closure and for what period of time. But we're not in a position to announce today, but we'll be doing that tomorrow. Elizabeth?
Great, thanks, Paul. So just going to let you know about the number of cases we have today. We're up to 91 cases as of noon today. The details around those cases you can find on our website as we've been posting there. You may notice that there's a significant increase in the number of cases over the last couple of days. That is because the Public Health Lab, who'd had some challenges in running the test due to restrictions on the chemicals that were available to run them, they've now been able to run more tests, and so we're seeing a lot of those tests that were pent up now come through the system with results. So we're up to date, getting back to people each day on those that are positive or negative. We do know that for some people, that means it may have been as much as 10 days from the time that they had the test done until the time we're getting back to them. So you can expect to, as well, continue to see those numbers rise at a sort of more significant rate as that backlog goes through. The cases that we're looking at that come back to, that are coming through date back to as far back as March 9th in terms of when they became ill. There is a lot of media interest, I know, and public interest as well about exactly where cases are located, or where they live, or where they may be. Really, we need to respect people's privacy. We can't give a lot of specific information about cases because that is their private health information, and we're bound to protect their privacy. So we will continue to share any trends, or if there's any clusters or outbreaks, such as in long-term care homes that we're aware of, but we won't be able to give specific details for each case. As well, that really becomes unsustainable as we go forward and have a larger number of cases. We do conduct, for every confirmed case still, we conduct that contact tracing and follow-up for each and every one. If people have questions about that, they can contact us at Public Health, but we do reach out to each contact as we go through. There are, just in terms of the community spread, which is why you've seen the increased number or increased attention by David Williams around the restrictions that he's asking that people take. We do continue to see an increasing number of cases that are indicative of spread in the community, and there's 21 of those so far, of those 91, in addition to the others that are travel-related or are directly contacts of existing cases. We have had one additional case in the homeless population, as Paul has just mentioned, who's now in the isolation shelter. That case is still under investigation, and we won't have more details on that one at this point. In long-term care facilities, we still have just one outbreak in long-term care facilities, which is great news. There's a lot of really difficult work that's going on, both at Heritage Green, where the outbreak is going on, but across all the long-term care facilities. We know how difficult it is for families not to be able to see their loved ones as we move forward, but it is so important for this population that we protect them and keep them healthy. At Heritage Green, there are now 17 residents who are ill. And the one death that had been reported earlier, we have 10 staff members who are ill as well. So you can see the impacts that these outbreaks can have in long-term care homes and why it is just so important that we work hard to keep the virus out of any of these places. As you heard from David Williams earlier today, and as you heard the Mayor and Paul speak to already, the importance of protecting those that are 70 and over. We really want them to stay at home, to have people support them so that they can do that. They are the people that will have the most severe complications from this disease, and so we're trying very hard to protect them and all others that have any sort of compromised immune system or chronic medical conditions to prevent them from becoming ill. So Dr. Williams is really strongly recommending that people stay home except for accessing healthcare services, shopping for groceries, picking up your medication at the pharmacy if they can't deliver it, walking your pets if you need to, and of course supporting other vulnerable members in your family or in the community. So we are expecting that these measures are going to help us flatten the curve. It is going to take us some time now that we're 1 week post-March break. We're still seeing travel-related cases from the closure of the border and from people returning home. But we really do expect over the coming weeks to see some response, some results from this flattening curve. It's good news out in BC. Bonnie Henry, the Chief Medical Officer there, is already reporting that based on their calculation, they're seeing impacts. So we really ask that you continue to observe these things, reinforce them with your friends, your family. We know for a few people, they're still not quite believing that this is absolutely necessary, but the more we show them that this is the way we're going to handle the outbreak, the more influence we will have on them to stay home as well. So that's it from me, Mr. Mayor.
Thank you, and it's very important that we reinforce the message on personal protective equipment donations, whatever you have out there in the broader community, business or otherwise. If you have a stockpile of material, please provide that to the City of Hamilton. And again, you can email ppe@hamilton.ca to get that material to our Frontline workers, and we do have to express our appreciation for everyone out there right now that is keeping our city functioning and keeping our people healthy. So everyone working in the healthcare system are heroes at this moment. They're out there doing the work they need to do to help us get through this crisis and help individuals get better and get well. Public works servants that are out there day in and day out maintaining our city and fixing water lines and collecting the garbage. A lot of people are continuing to work to maintain our city. And with good fortune, we have a federal government that is putting up the resources to help stabilize individuals, businesses, and our economy. And I know that some $130 billion has been put out so far. A little bit of patience in terms of getting it into the hands of the people that need it, because this is a massive effort, but help is on the way, and I know that there's more to come from both the provincial and federal governments. So everyone's doing everything they can to stabilize our communities and individuals and businesses in our community to the degree that we can. Your job is to stay with this isolation and physical separation, if not at all times, please, more often than you can possibly imagine. And I have to be honest with you, for longer than you can possibly imagine. And so stick with it. I think the reality is, I think you can tell by the newscast that I'm sure you're all watching, that this is not an item that's going to go away in a couple of weeks. It may very well be a few months. So hang in there, bear with. We're all in this together, and we ask you to do your part, as we are all trying to make a best scenario for our city, so that when we come out of this, we'll have minimized illness and minimized loss of life and minimize the negative impacts in our community, and hopefully get back to what we're all looking forward to, is hugging our grandchildren and our children and hanging out with our friends and being with everyone that we care to be with, and being able to enjoy our community the way we have in the past. So on that note, I'll offer it up for questions from the media. Thank you.
Our first question goes to Joanna from The Spectator.
Hi, thanks for taking my question today. This is for Dr. Richardson. The news about Heritage Green is pretty shocking, especially because I was led to believe there's only one new case in the home. Can you talk about, are these cases all on the same floor still? Are any of them in hospital? Does the long-term care center still have enough staff if that many of them are sick? Can you tell us a bit about what is the situation at Heritage Green?
So I think one of the things that's important to understand when we manage outbreaks in long-term care facilities or any other institution or group of that sort is we only test a certain number of people, because once we've tested and ascertained what the virus is that's going on and causing that outbreak, then we don't test further. So you're right, there's only one more person who's tested positive, but then we start just looking at the number of people who are ill and counting those. And so overall, we're at 17 that are ill in terms of residents and 10 in terms of staff members. I appreciate the numbers are large, and of course we're very concerned about those, and it is that viruses can spread through long-term care facilities in such a way that makes us very protective in terms of what goes on in those facilities. We do, we've seen, unfortunately, instances of spread elsewhere in other homes. In this particular home, there is more than one floor involved at this point. The ministry has, as you may have noticed over the weekend, looked to rededicate their long-term care home inspectors from being inspectors to being supportive in working with long-term care homes such as this to look at what they can do in terms of accessing PPE, in terms of having staff available to them. And so we know the ministry is in working with them in order to ensure they have the staff and the PPE to continue to operate.
Joanna, just before you ask your next question, I'll just ask everybody on the phone to please mute your phones if possible. Go ahead, Joanna.
Okay. So does that mean the home currently has enough staff? Do they have enough staff? Do they have the proper amount of PPE? I mean, we heard at a provincial press conference today that there is not actually enough PPE in Ontario. So do they actually have the PPE they need, and do they have enough staff?
So there's no doubt in Ontario that, as in much of the world, that personal protective equipment, or PPE, as you're saying, is absolutely in high demand, and everybody is concerned about the supply. The province has been working hard on it, and has started to survey about it and those sorts of things. And we're all working together to share it to make sure that people do have it. We have not heard from them that they do not have PPE to continue operating or they don't have staff to operate. But again, once the ministry is in there supporting that process, they're the ones that are primarily addressing those questions and working it through.
Thanks. Our next question goes to Samantha from CBC. Samantha, are you there?
I am. Sorry, I forgot to unmute my phone. That was my phone. My question's for Mr. Johnson. My first question. You mentioned that we're getting some bylaw money from the province. How much are we getting, and how is that going to be used?
Sorry, Samantha, which funding pot were you talking about?
You mentioned that we're getting some money for bylaw enforcement.
No, we received some ability to enforce through the province. So previously, we were assisting police, but police could only do the enforcement. That's now been extended to our bylaw folks, so they can do some of that work themselves. So that's the change. No new funding for that. So we're working with our existing officers, and they're fine with that. They're looking at how they can assist police. So I think it's about more people being able to follow up on those instances, but no more funding for that.
Mm-hmm. And just so I'm clear, are we talking about cracking down on events of more than 50 people or events of more than 5?
So now it's more than 5. So that's the change. And the other piece is still looking at businesses that are open that should have been closed under previous orders as well. Also understand from the Premier's announcement today that certain things that run out, I think, tomorrow or Wednesday are going to be extended for another 2-week period. So this will continue to be something that we can enforce. And you know, I would say, listening to our bylaw folks, that the vast majority, and I think Elizabeth shared this with us in the early stages of this, the vast majority of businesses and entities are complying. I will say that we still do get requests flowing through us for people that want to figure out ways that they can bring people together, and I get it that they want to do it in safe ways. I think today I'm actually pleased to hear the direct and a little less gray language from the province, and that is, we are not talking about finding ways to make it a little safer to get together. We are being asked not to get together. We're being asked to stay at or very near our home, and we're being asked to only venture out under very constrained circumstances, and those have to do with things that we just can't do without. If you're an essential worker, you need to go to work. If you have to get groceries, which we all do at some point, you need to go to the grocery store. So I think that clarity is helpful for us, and I think that's the bigger piece. It's not so much the businesses that may have tried to reopen. Those are few and far between. I think for me, what's more worrying is people still feeling that it's okay to go out and do some of the things that they normally do. I was disheartened to hear that in one of our suburban areas on Friday night, when the weather was just a tad warmer and not wet, we had tons of kids playing in a skate park. And you know, to the parents who I know their kids want to get out, and normally, hey, I want to go out and play with my friends, the answer should be yes. And we're going to have to do a whole lot of work, Elizabeth, and re-getting people back into the messages about good participation in healthy activity. But right now, that answer is no. And what's happening is we're not seeing that occur. So that's a long extension to the answer. I think, yes, we're focused on the things covered in the order, gatherings of more than 5, businesses that shouldn't be open. But to me now, the real question is, why would anybody be gathering together in any way with large numbers of people, given the word that's come down today?
Just to follow, can I just follow on that? I think the province also put a very strong emergency order in place for retail businesses in Ontario for not price gouging on mask, gloves, and personal protective equipment, non-prescription medications for treatment of symptoms of coronavirus, not on disinfecting agents intended for cleaning and disinfecting objects or humans, and personal hygiene products, including soaps. So any price gouging on that, and that again is potentially enforceable by our own bylaw, or a complaints line can be utilized. very strong order to ensure that there isn't price gouging on these very critical items that are out there right now.
So how much can people be fined for having a gathering larger than, say, 5 people?
So fines for certain pieces can be $750 per individual. Corporations can be up to $500,000. So if you want to get the full list, we can make sure that you get access to all the things that were in the order. But individuals, it could be several $100s, as I say, up to $750. And corporations we're taking a much stronger approach at, because businesses and organizations should know better. And now what we're continuing to say, all of us, I think, here on a repeated basis, is individuals need to know better now too.
Thank you.
Our next question goes to Dale from CHCH.
Hi, guys. Thanks for taking my question. Dr. Richardson, do you have a general sense of how many people in the shelter system are currently at the isolation center and how many of them have been tested?
So there's only one individual at the isolation shelter.
And so what are the challenges in doing the contact tracing with somebody in the shelter system or that's homeless?
Yeah, it's a good question in terms of working through the contact tracing. It is a little bit more challenging because of the usually the nature of their days as they go through them, but it is work that our staff do for other cases as well. This isn't the first disease that they've had to do contact tracing for with people who are homeless. We have to do it around other things such as tuberculosis or other sorts of things. So they will work it through and work with that person just as they do with others to understand what their days are like, to understand how long they've been ill, to understand how close they are with other people, and work with any other staff who may have worked with that individual as well to really understand the contacts and follow them up.
Thanks. Our next question goes to Tevia from The Spectator. Are you there, Tevia? Okay, we'll move on. And
Sorry.
Tevia, oh, go
Sorry,
ahead.
I am here. I was on mute. I've got a new phone. I'm just trying to sort through. Sorry, this is a question maybe that Elizabeth or Paul can address. It's also related to the shelter situation. I've heard some calls from the community to say, let's open up our hotels and get everyone in the shelter system into hotels. I was wondering if you could speak to the feasibility of that and at what point might that happen? What are the circumstances that you would deem it necessary to do something like that? Paul, you mentioned 400 or so hotel rooms that are available. I'm not sure what the breakdown and how those would be broken up among different uses. That's my first question.
So Tevia, I'm not sure I have an answer for you in terms of what it would take for that. I mean, the feasibility of shutting down our shelter system and moving it into hotel rooms would be massive and monumental. And those discussions about how best to handle the shelter system happened, right at the beginning of this. They were not just informed by shelter operators and our own staff. They were informed by physicians who were also so healthcare people providing us some support. So the system we have right now is one that we agreed would be helpful at this stage. We are moving people into hotel rooms to ensure that we don't have overcrowding situations. In a normal situation, if a few extra people need to be squeezed in the shelters generally do that. We don't want that to be their approach during the COVID-19 outbreak, so we are utilizing some of those rooms. But the pure logistics of actually decanting the entire shelter system, which actually would fill all those rooms, which then would allow us not to have any extra space for new people moving into the system, we just did not feel that was the appropriate avenue to go down. So we continue to work at this, isolate within the shelters while testing is being done, isolation shelter for those COVID-19 positive in their recovery so they can have access to health care and the right supports to get healthy, work with our hospital system if people need to be admitted to the hospital system. and continue to do all the work with public health that we continue to do. So, would that change at some point, Tevye? I never give guarantees anymore. I don't know, but I can't tell you at what stage that would be. Part of the contingency, though, is if we did have a problem with the shelter and not be able to operate that shelter anymore, this would give us the flexibility, which is another reason why decanting the whole shelter system wasn't really on the table at the beginning. This would allow us to have spaces if we had to quickly mobilize and do something different with one particular shelter. We would have those spaces available for us.
Okay, my follow-up is, Paul, maybe you could provide just a little more detail of what's happening at the Veneno Community Center. So right now, I imagine one guy sort of maybe sitting in a bed there. Can you give a bit of description of how that community center has been adapted and what sort of, what it looks like or what services are offered there now?
So for the setup of it, we worked with the Red Cross to receive cots and linens. So it's very much like a shelter, and it would be a kind of bare bones shelter. Its purpose is to make sure that we can isolate, as the name suggests, and separate COVID-19 positive individuals into a particular shelter so that they can get the proper care and support and treatment. So all the things that they need are provided. Obviously, it's a recreation facility. There are washrooms and showers available. We have made provisions for food to be there. I don't know what's going on inside it, to be honest, on a minute-by-minute basis, but it's meant there for people to be recovering. It's meant to have all the things that are necessary for them to do that in isolation. And then obviously we have strong connections with the healthcare community to monitor the health of individuals so that if their condition worsens and we need to consider hospitalization, we would make sure that occurs. And just to remind the public again, we set up a transportation approach that utilizes a separate vehicle. So again, we utilized all of the things that we set up when we first had this sitting empty. All of those things kicked into gear with this, and we'll continue to if we need it for further people.
Thanks.
Our next question goes to Jennifer LaGrassa from CBC.
Hi there. This question is for Dr. Richardson. So in regards to the man that we were talking about who tested positive at the shelter, what is the general risk to others within the shelter? So has the place been cleaned? Is there anyone else that's been put into isolation?
So at this point, we're just investigating this case and going through and looking at all those issues. I don't have any specifics on that at this point.
Okay, and then can you speak maybe more to some of the risks that those in shelters particularly face with COVID-19?
Absolutely. They're definitely one of the vulnerable populations that we've been talking about. These are individuals whose health is compromised for a number of reasons on a regular basis. They may have chronic underlying conditions, or it could just be because of poor housing conditions and lack of access to many of the basic needs that we all have on a day-to-day basis. So this is a group that we are concerned about, that this is why the isolation shelters have been put up, so that there is the ability to isolate them away from others and to make sure that they are well cared for during that time. So definitely a group that we are concerned about in the kind of measures that are being taken to ensure that there are supports there and access to healthcare and to testing for those who need it.
Do we have anyone else on the line that hasn't had a chance to ask their question yet? So we have a few more minutes, so maybe we'll just take a couple more. Joanna, did you want to ask one more question? Maybe Joanna's gone. Samantha, I think you said you had another one?
I do. Just a quick one. This is a question for Dr. Richardson. We have outlying areas. I know I'm thinking particularly Haldeman Norfolk, which has an outbreak at one of its long-term care homes, and actually 23 cases now. And we know there's a doctor shortage and some health challenges there. And it's my understanding that what they do with a lot of it, that the hospitals there have very limited capacity, and what they do is they send their cases to Hamilton. Are we at all worried about our ability to accommodate the cases in some outlying areas? And is anything changing about that situation?
So when it comes to managing people who are ill, you're quite right. The health system does use all of its resources, and different hospitals have different degrees of capacity to look after people with different levels of illness. And so there's been a real initiative by all of the hospitals, all the health partners across Ontario, and particularly here, we're part of what we call Ontario West, and looking at what our resources are. Where will people go when they're ill? Well, how can we increase capacity across the whole system? So I'm not particularly worried about that particular situation. There are, as I said, there are plans in place to have everybody back each other up. The biggest concern, again, is the reason why we're flattening this curve overall, is that no matter what in terms of the backup spaces and the different places that we have, the good resources that we do have across the province, that unless we slow this down, unless we limit the spread of this and really slow down the rate at which it spreads through our population, that we will then overwhelm all of the resources that we have, be they in Haldimand, Norfolk, at Norfolk General, or in Hamilton here, or anywhere across the province. And so this flattening the curve, the slowing this down is important for all of us, and we all have a really significant role to play in making that happen.
Okay, thank you.
Dale, did you want to ask any more questions? Maybe one more?
Yeah, Dr. Richardson, at the Heritage Green Nursing Home, out of the 27 people, the 17 residents, and the 10 staff that are currently ill, are the symptoms consistent with COVID-19?
Yes, that's our understanding, is the symptoms are consistent with COVID-19.
And Tevye, a follow-up from you?
Yes, please. Just a couple things, actually. I'll throw them out there and see if they stick. I heard plural, isolation shelters, plural, and I just wanted to clarify that. And the second thing, Mayor Fred, maybe are you able to elaborate a little bit on how the public will be able to listen in like they did before when you guys do have this council meeting that you mentioned that's coming up?
So I can answer the first question. It's isolation shelter at Bonetto Community Center, Recreation Center.
Great, thanks.
So thanks, Tevye. That my understanding is that the council meeting is going to be live streamed the way we've live streamed them before. They're finding a way of doing that. We had some testing today, so we're conducting the meeting through Zoom, and there will be a live streaming component to that, or the public at large can participate in Zoom. I'm not sure which it is, but it's going to be a public meeting one way or the other. So media, public, and anyone else that wants to dial in, will be informing them how to do that, where to do that, and when to do that, prior to our meeting, well prior to our meeting. And the agendas for the meeting will be distributed in the same way. So everyone can have an understanding of what's on the agenda and what council is deliberating and voting on.
Great, thanks very much.
You're welcome.
And maybe we'll have one more, Jennifer, if you have any follow-up questions, and then we'll pass back to Mr. Mayor.
Yeah, for sure. I'm not sure if I missed this, but those at Heritage Green, have they been tested, or are they not being tested at all?
So the way it works with outbreaks is once you've identified what the organism is, what the virus is that's causing the outbreak, we don't do more tests, because it's not a good use of testing supplies once we've already determined what it is. So that happens anytime we're doing an outbreak. We get allocated how many tests we can do in that particular situation, and then we don't process any further. So we won't be doing any more tests in this case unless there becomes some reason to do other ones, to look for other organisms or something like that, other viruses. But I don't foresee that happening.
Okay, thank you.
All right, thank you all very much, and we will be back here tomorrow at 3:30, same time, to do an update, and of course on Wednesday at the town hall for the community at large to bring in questions and hopefully get some answers to the questions they might have. So thank you all for the work you're doing in our broader community. It is critically important that you keep doing what you're doing and then some. There are some services that could use your help. Blood.ca, blood donations can be delivered to, or you can make a contribution by getting a hold of them, and they would be more than happy to get a donation from you. There's a critical supply shortage, I understand, and you can be helpful. And continue to help your neighbors, help the local restaurants that are doing online delivery or services. Try as much as possible to do online work, and as much as possible to stay home for all of you. Not just some of you, but for all of you. Thank you, and we'll see you tomorrow.